Hey guys, thanks for coming and checking out another episode of In Your Mind. Today we are sitting down and chatting with one of the co-founders of the Oculus Brain Centers here in San Diego. Ben has so much info to get. I'm so excited for you guys to get the chance to get to know him. Hounded him with questions. But I promise you're going to learn so much about this holistic brain health and all the services that they provide. You're going to love it. So enjoy. Hey guys, welcome to another episode of In Your Mind with me, Paul Payne. Today we have a very special guest with us. His name is Ben Terrano, and he is a doctor with Oculus Brain Centers. I'll let him go into detail as to what that entails because I promise I'll say the wrong thing. And welcome, Ben. I'm so excited to have him here. So Ben, welcome.
Thank you for having me. Appreciate it.
Yeah, so I guess this might be a little different for you, but we start with the same question with every and so this will take us down one path, but I promise we're going to come back. Tell us a little bit about Ben as a child and growing up.
All right. That is a different direction. Ben as a child, that's a great question. I grew up in Northern California. So I grew up in Chico, California. It's about an hour in Sacramento. Kind of the big city within all the farming or rural towns around there. I was really active, played a lot of sports. It's kind of a nomad, if you will, kind of bounced around to a lot of different groups and populations and kind of hung out and got along with everyone. I have a couple siblings. I have 3 older sisters and an older brother, if you can believe it. And yeah, life was good. I liked growing up in Chico. It was really a fun town to be in. It definitely got hot in the summers. And baseball was kind of maybe my go-to sport. I was pretty good with school. It kind of came pretty natural. And then my whole family, I grew up in a nursing household, basically 100% nurses, and got to the end of high school actually, and I thought I was going to go that. It's kind of hard to make it in Hollywood, if you will, coming from small towns such as that. So I started getting real and trying to figure out what I wanted to do, and ultimately on my specialty now, which is functional neurology, we'll get into. And I mean, it just fit naturally. I was majored in kinesiology and psychology, and that's functional neurology is a pretty strong marrying of those two, if you will. And it's kind of my.
When you first went to college, were you pursuing acting or were you? Okay.
I was, yeah, the first semester.
Wow.
And I was doing some massage on the side. So I was a massage and I really liked that interaction, that one-on-one with somebody and kind of that connection. So that kind of started go down that route of physical or manual medicine.
Did you do that right after high school then, massage, and then college?
In college,
wow,
exactly.
That's awesome. And I mean, it's funny you say that. I think I've mentioned at least once on here, I went to college and thought I was going to be like a singer. So I went a really different road too, and then switched it up and went back to PR.
There's still time.
But yeah, all right. Yeah, you too. I mean, come on. So tell me where I can assume a little bit growing up in a nursing household, there has to be love of medicine sort of ingrained in you in some way. How did you make that leap from I'm on acting and go into this?
It wasn't much of a leap, we'll say that much. I didn't really have an established career. But yeah, there never was really too much of a, you should do this. Parents were always just kind of, I don't even remember discussing, since I'm sure our brains were all over the place as kids. But yeah, I think it just kind of was a natural fit. I think I was looking once I got into college and said, oh man, I'm not going to be an actor. Kind of had that freak out moment. I might have reverted back to what I was comfortable with maybe. But it wasn't too much of a discussion or, we talk about nursing a lot of times. We're pretty, I guess, open regarding that as a family.
And
whether
whether
it was a off the cuff career or what have you.
That's great. When did you decide that, or I guess get connected to the Oculus Brain Centers?
Yes, I'm one of the founders and co-owners with my business partner, Dr. Stephanie Barbakoff. We have been practicing functional neurology here for the past few years. I originally got exposed to functional neurology in a practice in Chico, where I'm from. I said, man, I love that. That was back in 2011 or so.
Okay.
Which ultimately pushed me into getting my postdoctorate in functional neurology. So that's been a accumulation of the past decade or so, where myself and my business partner got to a point where we saw a need and ultimately a niche market that we want to be able to help with regards to that, whether it's San Diego or the greater area.
And can you explain to us a little bit about what that, I know you said it's a general term, so what does that encompass, everything that you guys are taking care of?
Sure. Yeah, as far as functional neurology?
Yeah.
Yeah, so functional neurology is ultimately kind of the gray area of healthcare. So where medical neurology will typically the black and the white and tumor extractions and stroke rehabilitation and things along those lines. We are perfectly kind of nestled into that gray area where there's not necessarily pathology or there's not necessarily A plus B equals C. We see a lot of A plus Z plus Y equals, and we're kind of detectors from that standpoint. So functional neurology really utilizes, if there's no gross pathology in those areas, what's causing the dysfunction or the disconnection here, if you will. So we specialize in conditions such as concussion or chronic pain, metabolic disorders, dizziness, things along those lines. We utilize really targeted and comprehensive neurological examination to find where there may be dysfunction in those areas and ultimately come up with strategies to get them to function better without the use of drugs or surgery. So we're not traditional neurologists where we're utilizing these types of techniques where it's drugs or surgery. We kind of have a tool belt of alternative therapies and more of a holistic approach, if you will.
I didn't even know that existed, honestly.
Most people don't until you, honestly, it's kind of sad, but I usually tell my patients that it's kind of when you're in that realm or you have one of those conditions that you typically find out about us, where you've seen 6, 7, 8, 20 different doctors, and that's when they fall into our wheelhouse where we can really dive in and get to work about what's going on there. You take migraine, for example, it's almost 100%, it's like 99.7% of migraines are non-pathological. There's not a tumor causing it or a brain bleed that caused it. It's more of these areas of the brain that are firing at improper rates.
Wow. And you can, I don't know if the right word is cure or help or alleviate that treatment, I guess, or what we think normal treatment is, right?
Exactly, yeah. That's the goal, yeah. Not necessarily a lot of the conditions that we do see are chronic or familial or lifelong. But yeah, the goal is to get people feeling better and ultimately without the use of surgery. Those are great techniques. We just don't utilize them ourselves. But yeah, I would say we help people, I guess is a better way to describe it.
That's amazing. Can you give us I have questions, so I apologize.
Love-loaded questions.
Idea of what does a holistic approach to any kind of thing that you guys take care of that doesn't include medicine or surgery or anything?
Yeah, it makes us. So we actually co-manage with a lot of clinicians and physicians here in San Diego and further. Those can be, again, great therapies. We fall into that niche category of what can we either bring to the table, or if you've tried all that, right? Since that's a lot of they've done all that, what can you utilize that's missing from that equation? So really holistic from the definition would be looking at the whole,
Yep.
right? What are all of the pieces together? How do you look at this and say, well, you stubbed your toe and now your toe hurts because you created some tissue damage there. Well, when that heals, you shouldn't really have any toe pain, right? For a select amount of people, say in chronic pain, if they have toe pain but the tissue damage is alleviated or it's gone, why do they have toe pain, right? Not necessarily the toe point, because the toe would have healed. There are other mechanisms that are ultimately our body or our brain go to be redundant. And in a lot of chronic pain conditions or patients, you'll have this lack of inhibition or this lack of calming things down, that's kind of creating this noise or allowing this noise to come to the surface. Please stop me if I'm using any terms that are whatever. I want to keep it. Ultimately, yeah, it's for that is looking at everything along the lines, and really that's the beauty of functional neurology is your nervous system, your brain does everything. You have complete control of basically other organs. Now there are some self-regulatory components to that, but your brain kind of plays a whole role in every single facet of your body and your health. Wow. So that's the whole in its entirety, if you will.
And do you guys, is it like, and I feel like I'm just going to sound stupid, so apologize. Is this like, I'm going to go to you and you'll say like, and I'm not saying this is all you do, but maybe one of the techniques is like we're talking like breath work or light or, like light therapy, things like that?
Yeah, no question's a stupid question to start off with, of course. And no, it's a beautiful question. We get that question all the time. Possibly. It's what's specific to you, right? Yeah. And that's kind of the beauty of functional neurology, and also a couple other disciplines that are really at the forefront of customized care, of looking at holistic, right? What's going on with the entire patient, but also what's specific to you. Because while we specialize in these certain conditions, I'll take concussion or traumatic brain injury, for example. You might have two people that have a concussion, but they have completely separate presentations or completely separate genetics or completely separate symptoms. And they might have been in a car accident together or some injury together. Well, why do they present differently regarding that? It also goes into kind of your question of where do you get therapeutically the recipe, if you will, for what comes down to a case-by-case basis. So we utilize a multitude of different modalities, and functional neurology is kind of a melting pot of a bunch of specialties. So some functional neurologists are osteopaths, some functional neurologists are acupuncturists, some functional neurologists are medical doctors, some functional neurologists are chiropractors. It's a point of saying, okay, well, you have all of these different options of therapy, have an X percentage of it working in this case. The goal of functional neurology is kind of to look at all of those different systems and find out where a majority of the breakdown is, and then ultimately utilize therapies that have the best probability of having in those scenarios.
That's amazing.
Does that answer your question?
Yes, no, it does. That's amazing. Sorry, now I feel like I'm just asking you all the questions now.
We'll go with that.
Where does I don't know if there's a threshold, and I've always actually wondered this with like a doctor. Like there's two different ways that at least I'm aware of like holistic, right? Holistic with the H, holistic with the WH.
Sure.
And like the holistic with the H for me comes to mind like crystal healing and energy workers, right? And then what you're explaining to me is like the WH, right? Like looking at the whole person and sort of figuring out what's happening. Do those categories blend for you guys? Or
not for ourselves personally.
Yeah, okay.
They can be great therapies, and I think what you're getting at is maybe crystal healing or Reiki.
Yeah, like is that something?
Those can be wildly beneficial. We're manual practitioners, so a lot of hands-on regarding that. There's a lot of great research with regards to vibrational components or tone or things along those lines. Yeah, it's really what delineates or kind of separates functional neurology on its own is a very comprehensive targeted examination, which doesn't usually come with those techniques. If
Yeah.
we're looking at from more of a what the heck's going on in the first place, and is there anything we can do, and then go from there. So yeah, we utilize techniques, but not probably in the sense of vibration of this and that. Literally, kind of massage vibration devices to maybe work on areas of the body that are really tight. That might be tight because of pain, or they're painful because they're tight, right? Or we might utilize actually a big thing. So Oculus brain centers, we evaluate and utilize eye movements in our. So we have a device in our office actually that objectively records with infrared cameras what your eyes do, and then we can utilize if there's any breakdown in those functions to rehabilitate those. You've probably seen in sports nowadays, maybe someone in football, for example, gets a big hit to their head and they go over to the sideline, and if they don't look good, they're out of the game for X amount of time. Well, what we look at is we say, okay, well, breakdown, where was the breakdown, and how can we get you back to 100% as possible? And that can happen inside of sport, outside of sport. But what we know with the modern research and kind of cutting edge diagnostics in concussion, once again, is early rehab is actually the best thing. It's not necessarily you should just rest for a period of time. You should actually rest, but then you should get right into rehabilitation to get those areas to function as well as possible, as fast as possible.
The topics, I guess, of things that you guys are going to treat all have, I don't even know if I'm using the right words. It's like a symptom, like a physical symptom. So not mental health stuff. It's more, or am I wrong?
No, yeah, that's a great question. Okay. We actually typically co-manage with more of mental health sides of things, just because now you're getting to more of a neurochemical imbalance. Now that's not always the case, because we do have a lot of patients that have maybe anxiety or depression that have great benefits or results from just kind of more of this brain-based approach of care. But I mean, we do have some patients that just want to get faster or stronger. We work with some elite athletes, Olympic athletes, and they're like, man, how do I get that extra, 10%? I'm at 98%. How do I get over the hump, if you will? Or some people that just want to see how they stack up with the competition.
And you just working on their brain can make them stronger and faster.
That's the goal.
Wow, that's crazy.
Yeah, and that might be actually, utilizing weights and physically trying to get someone stronger. A lot of the times with athletes, they have that. It's more of the connections from the brain to the muscle or to the joint that may be a little bit off, where they're just not getting as much bang for their buck.
Wow, that's incredible. What about like the diseases like fibromyalgia, things like that? That totally off?
Fibromyalgia, a lot of the times it's a blanket statement. It's kind of a blanket diagnosis of you're hurting and we kind of don't know what's going on. More often than not, there's something more deep or underlying from there. We have fibromyalgia patients in our clinic. Absolutely. We've been managing over the years as well. That's a loaded question. That can come with nutrition or more of a combined approach. We love working with naturopaths, whether local for that as well. Occupational therapists or physical therapists are really great with that as well. Medical professionals kind of in general. There's a lot of different techniques you can use. And again, that kind of comes back to customized. Is two patients with fibromyalgia you might do one thing that's perfect for them, and they try that again. You're like, what the heck's going on here? I don't know why this isn't working. It's very individualized, case by case regarding that.
And last question on this, I promise. Do you guys? I was talking about holistic and the two different versions, and then I just thought, what about like the CB type stuff? is like, where does that fall?
As far as what we do, or just
yeah, no, like what you do, like if that's even part of a holistic approach or not for you.
Sure. I could use my personal opinion on it. My holistic might not be the same as everyone else. CBD is phenomenal. I've gone back and forth. I've used some CBD products in the past. We don't utilize any currently in our office. Personal preference, we'll usually utilize that either from a pain management clinic standpoint, better products and way better results. So we'll say, hey man, we really think you should go here. Or we want to utilize their product short term. CBD can be wildly beneficial in chronic pain syndromes, as well as migraine rehabilitation. It can be really, really great for. That goes down a whole rabbit hole that we could teach a 25-hour weekend course on. But yeah, that kind of gets into more of that brain chemistry side. That's phenomenal. Topicals can be great, or ingestible can be great in certain scenarios. And again, in other scenarios of the same presentation, can be less effective. So it kind of depends. But it can be a great tool in your tool belt.
And now we'll go down the road that we should have gone down this whole time. I'm curious, like, because the stuff that you're doing, I'm curious always about doctors. I'm from a medical family. My dad was a PA, my mom was a nurse. How does that change you? Because you're so involved in people's lives, right? And you're involved in a critical way to help make their life better. Like, that has to have then an effect on shaping who you are.
Sure. Yeah, that's a great question. I love my job. I love my profession. It's very rewarding. Some days maybe not as much as others, and mental turmoil of working with maybe chronic pain patients, or the separation that sometimes you need to work on in order to make sure you're not taking the of okay, I don't want you to be in pain, let me take it for you. But it's incredibly rewarding to just be one-on-one and work with patients. I don't want to say most importantly, but it's huge when people are kind of at the end of their rope, right? So we see a lot of people that may have been everywhere, and they think that there's just nothing. They're kind of they're totally on their own, and there's no one out there for them, and there's nothing that can be done. To be able to at least maybe them, whether that's in our office or another office, or just be able to explain things, maybe not even be able to help them, but just say, here's what's going on. Humbled me over the years, very much so, to be able to appreciate my own health and my own life, and where I came from, and be able to utilize my I guess dedication to try to help others.
Awesome. With you starting this practice with your partner, how, like, it has to be scary, even if you're a doctor, to be like, I'm going to now go open something, right?
Yeah.
So how did that process go for you?
I think that's the most loaded question. It went well. It was fun. It was annoying. It was frustrating. It was beautiful. It was all of the above. It's been great. I worked with my business partner for the past few years. So we just kind of had this vision, and I guess that kind of goes back to the last question of really seeing things come to fruition. Our lens, or our vision, is to have a multidisciplinary or an integrative clinic long term, and just to have the foundation for that to see. And it's on the way, we'll say that much.
That process that you guys went through, was it a hard transition to go? I'm assuming you both worked at some medical place, and then that hard transition to go that way? No, not at all.
We kind of worked at a few places, and ultimately had this vision of what we liked and what we didn't like. So being able to compile that, was it super easy? Not by any means, but a framework, because things don't always go correct or go right, was huge to kind of stay on mission or kind of on goal. Yeah, the transition was easy. I would say all of the and finding and should this be this way or that way. She's more than me, so she can get all the credit for that.
And you guys have been now in practice together for how long?
We initially moved to San Diego in April of last year, and we opened in August. That's that time, I guess we'll say, that few months of turmoil or craziness. But we found a great location. We're located in Mission Valley. I can see Qualcomm, or I guess SDCCU now from our windows in our office. So yeah, pretty central. Definitely. As far as San Diego.
And I guess, I mean, this is an important question because of where we're at now, but this is a new business, right? Just started, you just opened in August. That's like the month I moved to San Diego from Seattle. How has this impacted you? Especially dealing, your patients and I don't know, like hazards that are happening outside in the world today.
Today, yeah, absolutely. Yeah, so if we're talking about the past couple months.
Yeah.
Yeah, it's impacted everyone.
Mm-hmm.
We, as far as our facility is concerned, we have maintained patient care for people that are low risk or ultimately are in so much need that they need to come in. But also that's kind of where telemedicine or more of our nutritional and supplemental side of things is coming on as well. Able to actually help people from distance, which has been phenomenal. It's been really great to at least stay active in the community and be able to provide services for those that really have nowhere else to go, and then you can't really see this or determine it was going to happen. So yeah, being able to just be collaborative and give people, again, a direction at least of where to go. It's definitely impacted us, but I don't think any different than anyone else.
Yeah, that's awesome.
Definitely some more than ourselves.
Do you think that for you guys and like your practice, are there going to be changes you foresee? Like, hey, these are actually here to stay now. Like, did you do telecommuting or not telecommuting?
Yeah, telemedicine
before. Yeah, or is that new? Like anything that you are like, this has actually affected us, and now we're taking it and moving forward.
That's a good question. I don't know. I believe that telemedicine's been around. I think it'll be a little bit more to stay. However, that's not necessarily the route that we will go for most, because we are physical medicine or obviously so much of what we do is in person. So that's not going to go anywhere in our case. I think anything else I'd stay on that would be speculation. So I don't think anyone really knows.
For sure. That's cool. Okay. Well, I feel like all I've done is grill you, so I apologize that you end your day
this way. That's what we're here for.
Or not even middle of the day, right? But I do have a question that I always end with, just like this. And it's simple. This one, I promise, isn't really that loaded. It's just, if you could talk to your younger self, that child growing up today, what would be something that you'd want to tell them?
The younger me, huh?
Mm-hmm.
Yeah, I'm sure we could talk for hours. It'd be easy to do on here. What would I tell younger me? I think a lot of people tell me, even though I am kind of goof, I always need to be reminded to not take myself so seriously. That's something I try to remind myself all the time, but I would put that in my brain, because I think that's something, especially in today's world, that as you get older, things get more serious. There's this, there's that. That time management thing we all strive for, just taking a moment to have to yourself, or say, you need to relax, or go have a beer on the beach or whatever. You can't have a beer on. Yeah, some along those lines.
That's awesome. I had one last question. Sorry, I had to add it. Do you do self-care yourself? Are there anything that you do that work great for you?
Sure. Yeah, I guess taking that, you're utilizing what works for you. I think that's different for everyone.
Mm-hmm.
As far as self-care is concerned, I mean, whether it's yours or it's a nap or it's a good meal, just taking that, that time for yourself. That's self-care to me. I always tell people kind of 95 roughly percent of your life should be self-care from just the physical side of things, whether it's exercising or eating correctly, doing things appropriate by your. The other 5% should be doing things for your soul, doing things that are fuel the beast, right? Not necessarily just fueling, but giving yourself those rewarding components.
I love it. Well, Ben, thank you so much for letting me sort of interrogate you on all of my random questions.
I appreciate it. Yeah.
It was awesome to have you here. And before we go, tell me how people get in touch or reach out. Like, what's the best way to get a hold of you or your company?
Sure. Yeah. Well, thanks for having me. I appreciated the interrogation. So we're Oculus Brain Centers. We're located in Mission Valley at 3530 Camino del Rio. In San Diego, people can find us at oculusbraincenters.com, or they can find us on social media at Oculus Brain Centers on Instagram, and our phone number on there.
Awesome. And I will make sure that all of that info. Again, Ben, seriously, thank you so much for taking the time. It's been awesome getting to know you.
Yeah, absolutely. Paul, thank you for having me. Maybe we'll do it again in the future.
For sure. All right, guys. Well, thank you so much for checking us out. Make sure to like, subscribe, all of those great things, and definitely check the comments, what I leave for you, because you want to follow Ben. He's awesome. But we will check you guys out next week. Thanks. So I want to make sure you guys remember, please like, share, subscribe, comment, rate, anything you can to help us make this show continue. So we need your help. Next week, we will be here again Wednesday. Thanks.